Hi everybody, welcome to this class. So in this class, we'll be discussing about two topics. We'll be discussing about abortions as well as sexual offenses. So coming to the important questions that you'll have to know in these chapters, coming to the long essays under abortion, you'll have to know how you need to define and classify abortion, methods used for inducing criminal abortion. You should also know about the diagnosis and evidence of criminal abortion in the dead, complications and medical legal aspects of criminal abortion. Because as you all know, criminal abortion is a punishable act, no? Because it can put the life of the lady and the child both in danger. That's why you need to know about it. In under shorts, we'll be discussing about MTP, the salient features as well as indications of MTP. So some years ago, the rules for MTP was different than what are today. So we'll look into that. Coming to sexual offenses, and along this, we'll be discussing about define rape, classify sexual offenses, the procedure of examination of the victim of rape aged under 14 years. So 15 years. So we'll be discussing about what are the findings in the victim, and not only in the victim, you should also know what are the findings in case of accused for the purpose of your practicals. I've discussed about all those in the practical sessions. Okay. Coming to shorts, we need to know about sodomy, examination findings of active as well as passive agents. Next question will be frotteurism, voyeurism, necrophilic, as well as bestiality. So these are the various questions that I'll be looking through in the chapter of abortion as well as sexual offenses. Now coming to why choose Auricle, because Auricle is a platform where you have various things under one roof. You have recorded classes, live classes, practical sessions, exam module, as well as hard copy book set. And all these 5 features are available for you in a single platform, which will make your preparation journey very easy. Coming to the recorded classes, these recorded classes are going to offer you flexible learning experience where you can access a fundamental class, foundation classes anywhere, anytime, and you can revisit these topics at the comfort of wherever you are in. And the expert instructors are going to focus on each and every topic, no matter how small or how big the topic is. Everything is going to be covered and you're going to be given in-depth knowledge about all the topics. This tool is going to be convenient for you to revise also, because at your own pace, eliminating the pressure of coaching up and allowing for better mastery, these recorded classes will help you in convenient revision. Coming to the live classes, so live classes are curated in such a way that it is going to give you in-depth coverage and comprehensive understanding of all the previous 10-year questions, the PYQs. You're going to choose the important questions and we're going to explain those. So these questions are the questions which can be anticipated to be asked in your coming exams. Here, the expert, experienced educators are going to give you skills like the answer writing skills. They're also going to give you study plans and so many more, so that your preparation journey becomes much more easier. These are going to be interactive learning sessions where there will also be emphasis on doubt clearance, MCQ polls, Viva VOC, and so many more. Coming to the express exam module, it is curated in such a way that the entire syllabus is completed in less than 20 hours. No matter which subject, we are focusing on covering it in less than 20 hours so that it is going to be effective for you in case you want to revise before exams. Here also we give you answer writing skills. We're going to tell you what diagrams or flowcharts you need to include and what pointers specifically you need to add to each question so that your scoring becomes maximum. These educators are going to give you various study plans also, and they're going to tell you how you can complete syllabus on time. We also have one-to-one doubt clearing session where a teacher completely focuses on a particular student. There's going to be a student-centric approach. Every question, no matter how big or small, is given equal importance, is valued and is addressed by the dedicated educators, because we want to ensure a comprehensive understanding of the subject from each and every student. There's going to be personalized attention to each student. Therefore, the student can clear any doubt the student has. It is going to be a safe learning environment where the student need not worry about being judged without fear of judgment. In a supportive and understanding setting, can understand the entire subject and each and every concept that there is. We also have hard copy note set. So our hard copy note set give you in-depth coverage of the entire syllabus. We also have a lot of flashcards. We also have a lot of images and flowcharts, and everything is in a colorful manner so that it helps you prepare wisely for your exam. And you have that pictures queue memory retained. and that is going to help you in order to recall, and that is how you can save time whenever you're studying. Okay. Apart from this, coming to the Q bank, we have 3 levels of expertise in the Q bank. It goes from the beginner to the expert level. Once you finish with the beginner, you can step on to the next level and finally go solve the expert level. Once you finish all the questions on the expert level, you have mastered the subject. There is no holding you back. So these are customizable. That is one of the amazing features that Auricle is offering you. Whichever topic you're studying from, you can customize those questions to your need, so that it will be an active recall of the questions that you have studied. So these questions are going to cover wide range of exams like Prof exams, NEET PG, as well as FMT. Now, coming to practical sessions, usually there is a gap between when practicals happen in your college and when you actually go and give your exams, okay? In order to bridge that gap, we are offering you practical sessions where we give you hands-on experience, where we engage you in interactive sessions that simulate real case scenarios. That is how you will understand what exactly a practical exam will look like. And the expert guidance is given throughout every aspect. Like, for example, Viva VOC, spotters, everything is taken special attention and care so that you do not miss out on anything. No, this is how you will be excelling in practical exams. Coming to the various subscription plans that are there, we have foundation plan, advanced learning plan, complete learning plan, as well as ultimate MBBS plan. Coming to the foundation plan, we offer you pre-recorded classes, live classes, express exam module, practical sessions, as well as QBank here. Coming to the advanced learning plan, you have the same features that are available for you up to a period of 6 months, okay? And foundation plan, as named, it was foundation, so it was there for 3 months. Coming to the complete learning plan, here it is for a period of 12 months. And apart from the features that I already mentioned, you also have hard copy note set and even one-to-one doubt clearing sessions that is available for you in the complete learning plan. Now, coming to the last plan, as the name suggests, ultimate. What do you understand by ultimate? It's final, no? So the same thing that is then the complete learning plan. All these features are going to be available for you for a period of 4 years. That is, you cover through and through your MBBS. That is the ultimate MBBS plan. So you can use my coupon code Dr Prashi kaveri 20 in order to get extra discounts on your purchase. Okay. Now, coming to the topic per se, we'll be discussing about abortion and sexual offences. And coming to the first 10 marker, we'll be discussing about define and classify abortion. So that is going to be the first part of the question. Methods used for inducing criminal abortion, diagnosis and evidence of criminal abortion in a death, complications and medical legal aspects of criminal abortion. So as you can see, this question has around 7 parts. So each part is going to roughly carry like 1.5 marks, okay? So you do not have to worry about writing chunks and chunks of details about each part. Just make sure that you kind of give a detailed explanation in crisp about all these parts that are there in your question. That way you're going to get marks. So sometimes what happens when the question has a lot of parts, you need to make sure that you cover each and every part. That is how you'll be scoring mark. Because if you write even 3 to 4 points about a single part of a question, you're going to get that 1 or 1.5 marks. So these are those questions in which you can save time. Now, coming to the definition of abortion, what is abortion? Abortion means premature expulsion of the fetus from the mother's womb at any time of pregnancy before the term is completed. So, as you know, 9 months plus 7 days is the complete time in which the fetus is going to be there in the uterus. So if this fetus is expelled from the uterus before this time, then it is called as abortion. Okay, it is premature expulsion of the fetus from the mother's womb. So this part is going to carry you 1 whole mark. Then coming to the classification, there are different types of abortion. We have natural abortion and artificial abortion. So natural abortion means that the fetus is going to be aborted either spontaneously, that is, you do not do anything, just by itself it gets aborted, or it could be accidental. These are the natural causes. Like, for example, the woman is going to travel in a bumpy road. These are the instances when there could be abortion occurring. So these are the natural causes. There could be artificial cause when for therapeutic purpose, that is, if the pregnancy is continued, if the mother's life is in danger, then the doctor advises abortion. Here, an artificial means of abortion is used. Or a criminal abortion when the woman out of wedlock might be pregnant and she isn't in a situation to carry forward the pregnancy. Instead of going to a hospital, she goes to some quacks. That is when a criminal abortion occurs. Okay, so these are the various types of abortion. Remember, classify it under natural as well as artificial. Now, coming to the next part of the question, methods of procuring criminal abortion. So what are the different methods? So we have certain abortifacient drugs which can be used in order to procure abortion. We also have general violence, that is, there is stamping or any damage done to the uterus because of which abortion occurs because of general violence. And also we have local violence. So these are the three things, okay? Now coming to everything in depth. Firstly, coming to abortifacient drugs. So what do you understand by the term abortifacient drugs? Abortifacient, that means these are the drugs that can cause abortion. Therefore, they're called as abortifacient drugs. So these drugs are going to act directly on the uterus. Okay, so there are certain types. One is ecbolic. What do you understand by ecbolic? Ecbolic means those drugs which increase the uterine contraction and hence cause abortion. No, during the end of the pregnancy, there's going to be a lot of contractions that are seen in the uterus, and these contractions are going to increase in severity and intensity until the fetus is propelled out of the uterus. If these happen before the completion of pregnancy using certain drugs which are called as ecbolics, then that is, we are causing artificial abortion. Okay, the example of these ecbolics which increase contractions are ergot. So ergot, it is the most commonly used drug. We also have quinine, lead, pituitary extract, synthetic estrogen can be used. And whenever we use synthetic estrogen, large doses are required in order to cause abortion. So these are the various ecbolics that we'll be requiring in order to cause abortion. There are also certain other group of drugs which are called as emmenagogues. How do you pronounce it? Emmenagogues. So what do the emmenagogues do? They're going to increase the menstrual flow. That is, they're going to increase the blood flow from the uterus, and eventually what happens? The fetus also gets thrown out of the uterus. So what are those substances which are acting as emmenagogues? They are the savin, borax, and estrogen. So remember, estrogen is both an ecbolic as well as an emmenagogue. So these are the various abortifacient drugs you need to mention about. And see, this is going to specifically tell the examiner that you know everything about this abortifacient drug. So you're going to get that full marks. So when you write, specifically write important points so that the examiner gets to know that you are thorough with the concept. Okay. Now the second type of thing that we can do in order to cause abortion is by using irritants of the genitourinary tract or the GU tract. So there are certain irritants. For example, oil of turpentine, catherites, and potassium permanganate. Why are these called irritants? Because whenever you apply these on the genitourinary tract, these are going to produce reflex uterine contraction. And as I told you, whenever there is more intensity of uterine contraction, it leads to abortion. So these irritants, for example, potassium permanganate, cantharides, oil of turpentine can cause abortion. Then we have irritants of the GI tract. It is going to cause irritation of the colon. GI tract, in the sense, it is going to act on a GIT, gastrointestinal system, and is going to in turn cause hyperemia and contraction of the uterus. Okay, because colon and uterus, everything is nearby, and whenever one part is affected, the nearby part can also be affected. And the examples for the irritants of GI tract are castor or croton oil, senna, and also magnesium sulfate. So here, remember, for each of these, I know it is difficult for you to remember examples, at least two examples. For irritants of GU tract, you can remember oil of turpentine and potassium permanganate. And for irritants of GI tract, you can remember castor and magnesium sulfate. These are the easy examples. Okay. There are also certain drugs which have poisonous effect on the body. In general, when consumed, they're going to cause increased contraction of the uterus. So what are those? Those are lead, copper, iron, mercury, unripe fruit of papaya, unripe fruit of pineapple, and juice of calotropis. So this papaya and pineapple concept, it is a concept of query from a lot of times, okay? But remember, as a doctor, your advice for a patient should be eating papaya and pineapple are fine to an extent only if it is ripe. If it is unripe, they are going to have certain compounds which are going to cause increased contraction. Therefore, eating unripe fruits of these should be avoided as much as possible. And it is not an fad that people are following. Okay, that is actually a proven thing. Unripe fruits should be avoided. Unripe fruits of papaya and which one? Pineapple. Yes. Next, we'll be looking into general violence. How does a general violence cause abortion? There could be intentional violence, that is severe pressure on the abdomen by kicks, jumping, or any a very hard or rough massage can cause expulsion of the fetus. Or there could be violent exercise like horse riding, cycling, driving over a rough road. So when all these happens, these are not going to let her rest. There's going to be increased motion in the body, which will eventually propel the fetus out. There could be cupping done. So what is cupping? That is a mug. As you could have, I think you would have seen cupping. There's a form of massage called cupping. In a similar way, a mug is turned mouth downwards over a lighted wick and placed on the hypogastrium. So basically, the female is made to lie like this, and we are taking this mug, and there is a lighted wick which is kept on the hypogastrium, and we keep that mug, and it is going to cause a vacuum kind of effect which is going to separate placenta from the uterus. That is how abortion occurs. Okay. Or there could be accidental when there is violent shaking of the body. That is why females usually whenever they're pregnant they are advised rest, because too much motion can cause imbalance in the body and cause abortion. Okay. There could also be local violence acting as cause of abortion, that is syringing, fluids injected into the uterus using enema syringe or Higginston syringe. So basically the women here also is made to lie down, and we take a syringe and directly into the uterus, we are going to put in certain substances which will cause increased uterine contraction and expulsion of the fetus. There could be suction action that is used in terms of local violence when a part of the amniotic sac and placenta are detached from the uterine wall, followed by hemorrhage, uterine contraction, and abortion. That is, you're trying to create a suction. So whenever there is suction, there's going to be vacuum created, because of which a part of the placenta or the amniotic sac separates off. And when a part separates off, there is going to be continuously parts separating off, and finally the body ejects out the fetus. Douche can be tried. What a douche? Using a syringe, with considerable force, you put in hot or cold water into the uterus or the vagina. And when you do these douches, it is going to cause rupture of the membrane by action of pressure, because of which there can be leak of the amniotic fluid. And when there is a lot of loss of amniotic fluid, the child or the fetus cannot move inside. There's going to be compression of the membrane, because of which there could be death of the fetus. So these are the local violence. So remember, whenever you're writing about local violence, write part specific things like something that happens in the uterus or the vagina: syringing, suction action, and douches. Got it? Now, coming to the post-mortem evidence of abortion. Abortion should be suspected when? See, whenever there's a woman who comes for post-mortem, when do you say that abortion happened before she died? This is what you have to mention here. Number one, deceased is pregnant and deeply cyanized. That is, you look at the lady and she has a visible bump, she's pregnant, and after she is dead, she's cyanosed. That is, there's going to be petechial hemorrhage, there is going to be congestion of the eyes. So when you see all these, you can suspect she underwent abortion. Instruments of procuring abortion found in the scene of death. For example, if you have syringes, Higginston syringes, or if you have douches, or if you have a vacuum cup, or all these things, whenever present at the scene of crime, says that abortion could have been tried. Underclothing appears to be disturbed. That means the underclothing is disturbed, maybe removed, maybe thrown away. So that is also an instance when you have to think of maybe a criminal abortion occurred. Or if a fluid which is soapy and bloodstained is coming out of the vagina. Simply, a woman, even if she is menstruating, you can understand the difference between the menstrual blood and a soapy or bloodstained fluid coming out of the vagina. No? So whenever a douching has happened, or whenever there is separation of the membranes or amniotic fluid, there could be soapy fluid that is coming out of the vagina. Now, coming to what are the complications of criminal abortion. Number one, cervical necrosis. There could be laceration, perforation of the vagina and the cervix. There could be vagal inhibition. There could be thrombophlebitis. What is thrombophlebitis? That is, there is going to be infection of the veins, because of which there is injury to all these vessels. There could be air embolism, which could cause could be a cause of septic embolism, and the lady might die. So these are the various complications of criminal abortion. Apart from it, there could also be hemorrhages seen, and when the hemorrhage is too much, there could be hypovolemia, and when there is hypovolemia, the women might undergo shock. There could be perforation of the uterus. There could be salpingitis. What is salpingitis? That is the inflammation of the tubes, fallopian tubes. Salpingitis. Oophorytis is inflammation of the ovaries, called as oophorytis. Peritonitis, inflammation of the peritoneum, and septicemia. So these are the various causes of death. Okay, or these are the complications that are seen because of criminal abortion. Now, coming to the next question, medical termination of pregnancy, salient features and indications. So, when we talk about MTP, remember that MTP initially it was given in 1971. Okay. So, according to that, what is MTP? So, MTP means medically or terminating. That is, it is therapeutic when women's life is in danger if pregnancy is continued. In such cases, the doctor only advises termination of pregnancy. Okay, there could be some other causes like eugenic. What is eugenic? That means if there is risk of child being born with serious problems, like for example, if the mother has got contracted with measles or smallpox or any viral infection or even touch or any other drugs, like for example phenytoin or alcohol during pregnancy, and you suspect that the baby might be born with severe congenital malformations, then that is, you do not want such child, no? That is when you advise a eugenic cause of abortion. Humanitarian, that is pregnancy caused by rape, the women will not want the baby, that is when because of humanitarian grounds you can seek MTP. Social, that is failure of contraceptive method in married women, maybe they're not that well to do, or they already have 2 children and they are used a protection but the protection did not work, even then you can ask for an MTP. Environmental causes, like for example poor economic status which affects mother or the child, that is they are in a very poor economic status where they do not have money in order to feed the child, or they have a 2 child already and they do not want the burden of one more child. Everything is expensive these days, no? That is on environmental grounds they can seek for MTP. Now, coming to who can terminate. So there are different doctors, okay? A registered medical practitioner who has assisted in 25 cases of MTP, and among these 25 cases of MTP in a recognized hospital, individually, that is by themselves, they should have done around 5 MTPs. That is when they can conduct MTPs on their own. Apart from this, if a doctor has done MD or MS or diploma in OBG, even they can terminate the baby. What is the place of abortion? Either a government hospital or a hospital recognized by the government or any other private hospital if they have taken license from the district health officer. So these are the places where abortion can be done. Government hospital or the hospitals recognized by government or a private hospital after taking license from the DHO, district health officer. Got it? Now coming to the next question. Define rape and classify sexual offenses and the procedure of examination of a victim of rape aged 15 years. So there are 3 parts, okay? Firstly, they're asking you the definition, and then they're asking you to classify sexual offenses, and finally, how do you examine a victim of rape? So the definition of rape, now instead of all these IPCs, you have BNS, no, the Bharatiya Nyaya Sanhita. So this rape, the definition of rape is given under 63 of BNS, okay? And Section 375 of IPC defines rape as unlawful sexual intercourse by man and women. That is, they're not legally wed or without consent. No, it is not lawful. Then it is called as rape. Before it came under Section 375 of IPC, now it comes under Section 63 of BNS. And this unlawful sexual intercourse happens against the will of the women or without her consent. She's not willing for the sexual intercourse and no consent is given. Okay, and sometimes we can say that a rape has happened even if she has given consent. When can we say that the rape has happened even with consent? When the consent was obtained by putting her or any other person in whom she's interested in the fear of death or hurt. For example, somebody has put her mother or her husband or her siblings in threat of life. They're like, if so and so process doesn't happen, they're going to be killed. In such a fear, if she has given consent, that is also considered as rape. With her consent, when the man knows that he's not a husband and that her consent is given because she believes that he is another man to whom she believes herself to be lawfully married. That means she feels like she's having sexual intercourse with the husband, but in the reality, that is not the husband. Maybe she is in a drunk state, or there was no power, or such and such reasons where she falsely believes that it was a husband. Even then, rape could be said. Okay, now coming to the classification of sexual offenses. So there are various types. Okay, number 1, we have natural sexual offenses, then we have unnatural sexual offenses, then we have sexual deviations, which are also called as sexual perversions or paraphilias, then we have sex linked offenses. Number one, coming to the natural sexual offenses, we have rape, we have adultery and incest. So rape is something that we'll be studying in depth in this question. Okay. Coming to unnatural sexual offenses, that means the sexual offense does not happen by the normal peno-vaginal route. The normal, see, whenever we say something is natural, that means the intercourse is happening by the peno-vaginal route. And if it is not happening by the peno-vaginal route, then it comes under unnatural sexual offenses. So we have sodomy, we have buccal coitus, we have lesbianism and bestiality under unnatural sexual offenses. We also have sexual paraphilias, where we have fetishism, transvestism, sadism, and pedophilia. So these are the sexual paraphilias. That is, these are certain behavioral abnormalities that are seen in the people where, like for example, in transvestism, person likes to wear clothes of opposite gender. In sadism, he tries to, harm the other person, and because of the suffering, he or she gets pleasure. Come to sex-linked offenses, that is indecent assault, and offenses under immoral traffic acts. So these are the various classifications that you need to know of. And this is something where you have to write particularly under these 4 headings about these things. And this is a very interesting topic to study also. So I don't think you'll miss anything. Okay. So I'm coming to examination of a victim of rape. If the victim who has undergone rape, for example, if she is a child and if she is above 12 years, then you need to take consent from the child itself. Okay. And the consent can be either witnessed, written, and informed consent is required. And if the victim is not giving you consent, then the examination cannot be undertaken. But in case of an accused, if the accused is not giving consent, even then you can use a considerable violence or considerable force in order to examine the person. Coming to the next thing that you have to do in the part of examination of victim, you have to ask a thorough history. You have to ask details about menstrual history, marital status, whether she's married or not, whether she undergone menarche, how many days is a cycle, when was the ovulation date, all those. Obstetric history, that means if she's given birth, if she is a prior, that then you have to ask about the obstetric history, history of any venereal disease, for example, syphilis or AIDS or any other venereal diseases should also be asked. History of the incident, what happened, how many people were involved, if she was a state of intoxication, did she use considerable force to resist the occurring, and all these should be asked. If she resisted, should be noted down. And after the incident, if she has taken a bath or if she has washed the local area, all these things should be asked. Next, examination of the cloths. Firstly, you need to confirm with the victim whether she has changed the cloths or whether she is in the same cloths. Ask the victim to remove them on a big white sheet of paper, because if there are any strands of hair from the accused or if there are any certain details that could be missed off, you do not want to miss it. That's why you ask them to remove everything on a white sheet of paper. Examine for tears, loss of buttons, because whenever there are tears in the cloth or loss of button, it is going to suggest that there was violence or struggle that the female underwent. You look for stains of any blood or semen or grass and mud, because grass and mud stains will give you an idea about the location of the crime place, and the blood and semen will help you in the DNA analysis, and you can find out who was the culprit. Okay. After you collect all these in the paper, you have to seal it, label it, and you have to send it to the toxicological examination. Next, you have to do a general examination of the body. You have to look at the general build, gait, mental condition of the person, whether the person was intoxicated, that is, whether she was in a drunk state, whether she was a drug should be asked. And then you have to do certain dental examination, and you have to also look at secondary sexual characteristics. You have to look at the X-ray, because all these will help you find out what is the age of the victim. And under age estimation chapter we studied, no? So you have to do all this, and you have to also check the nails and the under part of the nails. You have to look at any damage to the nails, whether they're broken or whether there's any foreign body, because usually when such an act of sexual offense or rape happens, usually the female, in order to protect herself, might have scratched the offender's face or back. That is when there can be skin debris and blood that is collected in the undersurface of the nail. So using that, you can scrape it out and do a DNA analysis. That's why you should also look at the nails. Okay. And also you have to look the body thoroughly for any stains of blood, saliva, semen, because using all these, again, you can do DNA analysis and you can find out about the accused. Okay. Next. What are the injuries that the female has sustained? The whole body must be examined for marks of violence or even struggle. Okay, so what all you look at? You look at the various organs. Like for example, you look at the face and you look at the conjunctiva of the eyes. You see whether there are any petechia. That is, if there are any petechial hemorrhages. What are petechial hemorrhages? Small reddish hemorrhages that are seen whenever there is going to be congestion or suffocation. You look at it. Okay, because whenever there is asphyxia, that is, the person's breathing is affected, there is forceful restraint over the neck, and all these things are done in order to make her unconscious. That is when petechial hemorrhages are seen. Injuries could be there around the mouth and the neck. And why their person does injury around the mouth and the neck? That is because whenever there's injury in the mouth area or the neck area, it becomes difficult to talk or scream for help. No, that is why. That's why you need to check at the mouth and the neck area also. You have to look at injuries over the face. If there are injuries over the face, it indicates violence. You have to look at the wrists and arms, or even thighs and legs. Okay, because whenever the thighs and legs are separated, there could be some congestion that are there. With thighs and buttocks, you have to look at any of the injuries that occur during intercourse. You have to look at back if there are any injuries from the ground, because usually she is made to lie in a back towards the ground, and when she's moved, there could be any injuries or abrasions seen in the back area. There could be any damages seen in the breast area. There could be injuries, bite marks because of rough handling. There could also be bite marks in over the face area. So these are the various things that you have to examine. These are the things that you have to keep in mind whenever you get a case of a victim of rape. You also have to examine the genitalia. What are the objectives? You have to search evidence of sexual intercourse. That is, maybe there is a tear in the hymen, or there could be damage. There could be bruising and contusion that are seen at the mons or the labia majora, minora, thigh area. And you have to also look at any details of forceful penetration or any other genital violence. This is what you have to look at when you examine the genitalia. Or you have to also look at if any foreign material was put into her introitus. These things should be kept in mind. So when you examine the genitalia, there are various parts that you have to take care of. Okay, so what are these parts? You have to examine the mons pubis. So mons pubis is a fatty tissue in the front, in the anterior aspect of the genitals. Then you have the prepuce. Okay, prepuce is the part that is going to cover the clitoris. So this clitoris under the prepuce. Then you have to look at the vaginal introitus. You have to look at the urethra. Labia minora is a small covering around these structures, and the bigger covering around this labia minora is the labia majora and the anus. So if you have to look at all these parts in order to see whether there was any injury, abrasion, or tear, in order to understand, and also you can get to know whether there was any part that was put into the introitus, whether there was a foreign material that was put. You can get to know all these. You have to record these injuries and evidence of tenderness. That is, whenever you feel for the part, if the woman complains of pain or tenderness, even then you have to report it. You have to look for the signs of the inflammation. Inflammation, how do you look at? The part is going to be swollen and red and hot. Okay, and you also have to look at the presence of semen. This is what you have to take care at the part of genital examination. Coming to the next question, sodomy, examination findings of active and the passive agents. So when you come and look at the passive agents, so passive agent is the one. So what is sodomy? Sodomy is nothing but a peno-anal intercourse. No, so the person in whom the anal route is used is called the passive agent. There could be pain and tenderness during the examination. Foreign hair of the person who caused sodomy might be present. There could be use of lubricant, because here, whenever anal route is taken, there won't be any lubrication. So sexual intercourse becomes difficult. Then they might have used a lubricant. There might be presence of lubricant in the area. There could be bleeding. There could also be bruising or perianal abrasions. Near the anal opening, there could be certain abrasions that are seen. Color changes, contusion or bruising that is seen. There could be tears in the anal area, which are called as anal laceration. There could be triangular in shape. So whenever, if you look this as the anus, there could be triangle lacerations that are seen with the base at the external sphincter and the apex inwards. That is, if I zoom this part of the image, if this is the anal opening, these are going to be the lacerations that are seen. The wider the base is going to be there outside at the external sphincter, and the apex of the triangle is going to be facing inwards. There could be contusions also that are seen. So these are the examination findings that are seen in a passive agent. What are the other findings that are seen in passive agent? Whenever you do a digital examination, that whenever you put a finger and try to examine, there is loss of elasticity or tone. Usually, there is going to be a increased tone at the anal sphincter that is going to become free in case of passive agent. There could be tearing of the sphincter ani, that is a rare finding, and there could be smoothness of the anal margin. And whenever there are injuries, because the tissue in the children are going to be very soft and tender, there is going to be marked injuries that are seen in the children. There could be pain during walking, there could be blood stains that are seen, and also there could be signs of struggle. Coming to the examination of the active agent, coming to accused of the rape, there's going to be injury in the penis. I told you active agent is the one who is going to use his penis in order to insert it into the anus of the other person. So the person who is using his penis is called as an active person, where there could be injury in the penis. There could be fecal matter or lubricant or blood or seminal stains that are there in the penis. Because if he is habituated and if he is doing this act with people who have venereal diseases, he might also have venereal disease. There could be marks of violence. And if he's a habitual person, that is a habitual active, who has been doing the same act, his penis might be elongated and constricted. Now, coming to the next question, fraudurism. What is fraudurism? As I told you, there is a type of classification of sexual offenses which are called as sexual paraphilias. Sexual paraphilias are deviations from the normal act. This is psychological, okay? So one such thing is called as fraudurism. So it involves a person touching or rubbing against someone without their consent, typically in public places like crowded areas, like for example, public transport, buses, malls, for sexual gratification. That is, they're going to stand near one more person. For example, usually it is a man who has fraudurism. They stand near a female and try to rub themselves against the female, and especially this happens in crowded area where it goes unnoticed, like for example a crowded bus or a crowded fair, a mall, etc. Okay, so what is the diagnostic criteria? According, as I told you, it is all the psychological problems. No, so according to DSM-5, fraudurism is considered a paraphilic disorder when it leads to significant distress or impairment in the social, occupational, or the important areas of functioning. So it is a psychiatric, psychological disorder. The individual with frauduristic tendencies may not always have an interest in establishing a relationship with the victim, but is primarily focused on achieving sexual arousal. That is, whenever he inappropriately touches the, or rubs himself against another female, he is going to be sexually aroused. That is his motive behind the act of fraudurism. Okay, what are the legal and ethical concerns? Is going to be, fraudurism is considered as illegal, and it is also considered as a sexual assault. It violates the rights and consent of the others, making it very unacceptable. This is what you have to know about fraudurism. And this is one question that can be asked in your Viva OC also. Okay, so whenever they ask about fraudurism, tell 2 points. It's a sexual paraphilia where a person rubs himself against the private organs or any other part of the non-consenting individual, usually in a crowded area. Got it? Coming to the next question. So next question is about voyeurism. What do you understand by voyeurism? So voyeurism is also a sexual paraphilia. That is a deviated type of sexual behavior where there is sexual gratification that is derived from secretly watching others engage in sexual acts without their consent. So somebody, for example, person A and B are having a sexual intercourse, and person C is going to peep and see the sexual intercourse, and he gets sexual gratification by this act. So this is also sexual paraphilia, that is a psychiatric problem. So it is also diagnosed under DSM-5, and it is diagnosed when the behavior persists for at least 6 months, which the behavior has to be present for 6 months. And this voyeurism, it was also called as peeping Tom, okay, so where he goes and looks at people having sex. So what is the psychological motivation behind it? Here, he will get a sexual arousal by observing rather than him actually doing the act. Okay, and it can be related to power, control, or an inability to engage in sexual activity in more socially acceptable ways. Okay, so usually all sexual paraphilias, the main intent or the motive is that they get sexual gratification by doing this and not the actual sex, the intercourse. Okay. So what are the legal and ethical concerns? Voyeurism is illegal and considered the form of invasion of privacy and sexual assault. Okay. Coming to the next question, necrophilic. This is a type of sexual paraphilia. So as you can see, so many things that we discussed now are all different types of sexual paraphilias. Okay, firstly, you need to be able to identify if it is a sexual paraphilia or not, and if it is a sexual paraphilia, what is it? Necro. As you can see, the word necro, something that is decaying, decomposing, dead. So let's look into what is necrophilia. So necrophilia refers to sexual attraction to the act of engaging in sexual behavior with a corpse. So basically, see, sexual activity with a dead body is called as necrophilic. So where does it usually happen? It usually happens in the mortuaries where a lot of bodies are kept. Okay, so this mortuary, the ward boys might be involved in a sexual paraphilia called as necrophilia. This also is a psychological problem. It comes under psychological disorders, and these people might also have attachment issues, fantasies of control or dominance, or a desire to complete submission. These are the areas where the psychological aspect comes into play. So necrophilia is also illegal because here, whenever necrophilia happens, it is basically sexual activity with the deceased person, and the deceased person cannot give consent. So all these sexual paraphilias are happening against consent or without consent. That is why all these becomes illegal. Plus, there is breach of privacy also, and in this case, there is going to be disrespecting of the dead body. Therefore, it becomes punishable. What is treatment? Necrophilia is considered as a serious mental health condition that might require psychiatric intervention. So all these paraphilias require psychiatric support. Coming to the next question. Next question is about bestiality. So what is bestiality? Bestiality is a type of unnatural sexual offense. So what is natural sexual offense? Any sexual offense that is happening through the normal peno-vaginal route is called as a natural sexual offense. Anything that happens to any other route is called as a unnatural sexual offense. And in bestiality, it happens between a human and an animal. Therefore, it is unnatural. What are legal and ethical concerns? Bestiality is illegal in many countries because it is considered as an animal abuse, as animals cannot consent for sexual activities. Okay, and in India, PETA, People for Ethical Treatment of Animals, these are the ones which will deal with all these. They're going to put you under bars if they find out that you're involved in bestiality. What are the psychological factors involved in the person's mind? Bestiality is often linked to underlying psychological disorders, including sexual deviances, emotional issues, or trauma. And there might be some people who are living in isolation in some forest where they do not have a partner, and these are also some of the people who are involved in bestialities. Individuals may engage in such behavior due to lack of human intimacy. They do not have anybody to be with them, talk to them. So they are socially isolated, or they have sexual dysfunction. So these are the instances when they'll go and take into bestiality. Okay, so these animal welfare people, they're going to come, they're going to look at the various physical injuries in the animal, or they're going to take charge at the psychological distress, and there could be the transfer of some zoonotic diseases from the animal to the humans also. Therefore, it is completely illogical and completely punishable. What is the treatment and prevention? Individuals who engage in bestiality may require psychiatric intervention because here also the person is not in the same mind. That is why a psychiatric intervention is planned, and you have to underline you have to address the underlying psychological issue. Now coming to the various MCQs in this chapter. First question is, criminal abortion refers to. Coming to the options, a legal abortion performed by licensed healthcare professional. No. If it was legal, then why the word criminal would come in the question? No, so that is not an option. Second option, an abortion carried out by an unqualified person or under unsafe conditions. Yes, could be an answer. Let's see the other options. A spontaneous miscarriage that occurs without medical intervention. No, it is spontaneous. That means it is natural. So that is not a criminal abortion. Option D, an abortion performed for medical reasons under supervision of a doctor. No. If it is under a medical reason under supervision of a doctor, then it is lawful. So it is not a criminal abortion. Therefore, the right option is option number B, an abortion carried out by an unqualified person or under unsafe condition. That is any quacks who doesn't have an MBBS degree, who is, I told you, he should be an RMPO, plus he should have done 25 MTPs, out of which 5 MTPs he should be have done it on his own, or he has to be an MS or an MD or a diploma in OBG. Coming to the next question, what is one of the main risks associated with criminal abortion? Let's look at the various options. Immediate relief of financial strain. No, that is not a main risk. No. Option B, severe health complications and infection to mother. Could be. Emotional and psychological stability. Okay. And option D, legal immunity for the individual seeking procedure. No. So the right answer is option number B. Whenever a criminal abortion happens, there could be severe health complications to the mother and there could be infection in the mother. As I told you, what are the infections of the tube? Salpingitis. There could be infection of the ovary, oophorytis, infection of the peritoneum, peritonitis. And because of all these, there could be septicemia that occurs and the women might die. Okay. Coming to the next question. Medical termination of pregnancy refers to option A, the surgical removal of fetus after 24 weeks of pregnancy. No, it's not after 24. It has to be before that time. Okay. The use of medication or medical procedures to end the pregnancy before a certain gestational period. Yes, could be. Before when? Before 27 or 28 weeks. That is usually before 20 weeks. But if there are two doctors that are involved, then before 28 weeks. The natural loss of pregnancy, no. If it is natural loss of pregnancy, why do we have to call it MTP, first of all? No. The act of delivering a baby prematurely for medical reasons, no. That is premature delivery of the baby. Therefore, the right answer is option number B, the use of medication or medical procedures to end the pregnancy before certain gestational period. Usually, according to the recent amendment, within 20 weeks, you can, as a single doctor, take MTP, and less than 28 weeks when you have the consent of two doctors, when you have a guidance or you have the info from two doctors, then it can be done within 28 weeks. Coming to the next question, according to the Medical Termination of Pregnancy (MTP) Act in India, the maximum gestation limit for an abortion without specific circumstances is. That means they're asking what is the maximum gestation limit for an abortion without any other special circumstance. So in India, the answer is 20 weeks. As I told you, maximum limit is 20 weeks. And if there is any special circumstance and the involvement of one more doctor, then it can be done under 28 weeks. Next question. Sodomy is legally defined as. So they're asking you, what is sodomy? Coming to the options, sexual intercourse between married couple, that is natural sexual intercourse. No, so that is not the answer. Option B, any form of sexual activity between man and women. No, that is also not sodomy. We want a specific proper definition of sodomy. Option C, sexual activity between person and an animal. No, this is an unnatural sexual offense where I told you, but if it is with an animal, it is called as bestiality. Anal sex between individuals regardless of gender. This is the right answer for sodomy. So the right answer for the question 5 is option number D, anal sex between individuals regardless of the gender. Coming to the next question, frotteurism is characterized by. So they're asking you, what do you understand by frotteurism? So we discussed this in the shorts. No? Let's see if you can remember. Okay. Coming to the options. Option A person deriving sexual pleasure from watching others without their knowledge. Is it right? Okay, let's see the other options. A person gaining sexual pleasure from rubbing against a non-consenting person. This seems like a right answer. Option C, a person experiences sexual arousal through viral behavior. No, this I asked you. No, this is BDSM. This is called sadism. Option D, a person engaging in sexual activity with animals. No, this is bestiality. Therefore, the right answer for this question is option number B, a person gaining sexual pleasure from rubbing against a non-consenting person. Usually, this happens in a crowded place, like for example, a public transport, like for example, a bus or a fair or a mall, where the person rubs his private parts against a non-consenting individuals and he gets sexual gratification. It's called as frotteurism. Coming to the next question, frotteurism is considered a criminal act because, why is it considered as a criminal act? Coming to the various options that are there. Option A, it involves a person willingly engaging in sexual activity with a consenting partner. If it was willing engagement, would it be an unnatural offense? Would it be a paraphilia? Would it be a criminal act? No, there is will. No, so that is not an option. Coming to the option number B, it is a form of sexual assault as the victim is not consenting the behavior. Correct. Here, the person is rubbing his private parts against a non-consenting female. That is why it becomes criminal. This could be an answer, but let's look at the other options as well. It is a natural and harmless behavior that is accepted in many cultures. No. Is it natural? No, it's a psychological problem. Is it harmless? No, because he's doing something for the privacy of another person. No, so it is a harmful thing. Option D, it only occurs between two consenting adults in private. No, if it was consenting adults in private, it wouldn't be a criminal act. Therefore, the right answer for this question is option number B. It is a form of sexual assault where the victim is non-consenting to the behavior. Coming to the next question, voyeurism is defined as. What is voyeurism? As I told you in the short, voyeurism is nothing but a peeping Tom. Here, the person gets sexual gratification by looking at others having sexual intercourse. Let's look at the option. The act of secretly observing others engaging in private behavior offers sexual arousal. Yes, could be a right answer. Let's look at the other options as well. A psychological disorder where a person experiences sexual arousal from fantasies involving violent acts. No, this is nothing but sadism. Okay, therefore that is not an answer. Option number C, the act of participating in sexual activities in public spaces. No, that is not an answer. That could be an exhibitionism or a frotteurism they're talking about. D, a sexual attraction to animals. No, sexual attraction to animal is called as bestiality. Therefore, the right answer for this question is option number A, the act of secretly observing others engaged in private behaviors, often for sexual arousal and gratification. Coming to the next question, bestiality refers to. So they're asking you, what is bestiality? As we know, bestiality is a type of unnatural sexual offense, okay, where a sexual offense happens between a person and between an animal. Let's look into the options. Option A, engaging in sexual activities with a consenting human partner. No, it is with animal. Therefore, that is not an option. Option B, sexual activities between human and animal. Yes, could be an answer. Option C, the act of marrying an animal. No, if he marries an animal and doesn't, has a sexual activity with it, it is not bestiality. D, the sexual arousal from watching animals in their natural habitat. That is also not the right answer. The right answer is option number B, sexual activity between human and an animal. Coming to the last MCQ for today, bestiality is illegal in many countries because. So the question is, why bestiality is illegal? Coming to the options, first of all, what is bestiality? Sexual activity between a person and an animal is bestiality. It is an unnatural sexual offenses. Now we are going to see why is it illegal in many countries. Coming to the options, animals cannot give consent and it constitutes animal abuse. Yes, could be an answer. It is considered a religious violation. No, nothing religious comes into this question. We're talking only about medical and logical things. It is a form of sexual liberation. No, that is not the answer. It is only illegal if performed in public. No, not an answer. Animals cannot be tortured in private also. So the right answer for this question is option number A. Animals cannot give consent. Therefore, it constitutes for animal abuse. Okay, so got it. So these are the 10 questions that we discussed today, and all these questions are chosen in such a way that these are going to be an active recall of every question that we discussed today. I hope you enjoy the class. Thanks for watching. We'll meet you all soon with one more topic.